Good afternoon and welcome to this teleconferencing session of induction meeting of postgraduate diploma in acupuncture. Friends, as you know, this is the first teleconferencing of this particular program, which is PG diploma in acupuncture. And in this session of next 40 to 45 minutes, we will be just telling about what is this course about, how many courses are there, how this course will be conducted, and what are the various support services which will be provided to you from the IGNOU. So the first in this session is basically the induction meeting, and the purpose of this induction meeting is to tell you about that what is this course about, how many courses are there, how this course will be implemented, how many contact programs will be there, how the examination will be conducted, and any other query which you have got in your mind. So we will try to clarify all these doubts. And to discuss all this about, we have got with us Dr. Raman Kapoor to my left. Dr. Raman Kapoor is the brain behind this particular PG diploma in acupuncture. Welcome, Dr. Raman, to this teleconferencing. And basically, it was with his initiative that IGNOU and IANM entered into a collaboration, and we developed jointly a program which has been nomenclatured as PG diploma in acupuncture, and he has put a lot of efforts for bringing this program to this particular stage. So today we are in the phase of that we have been able to launch this program. And to my right is Dr. Sunita Kapoor. She is also been putting lot of hard work in developing the contents of this particular program. She has been helping me in, throughout this last 6 months or 8 months in developing all the contents, putting this on the website, developing various practical modules, and on a continuous basis we have been working together for development of this program. Welcome, Dr. Sunita Kapoor. And I think these are the two persons who have been basically involved in this particular program. And Dr. Chadda is there because I think he has been not able to make it up because he has been stuck up somewhere. So let me tell you brief about this program. Maybe then I will request Dr. Raman Kapoor and Sunita Kapoor to tell you something about the acupuncture. Right now I will not go into the contents, but I will tell you something about the program. This program, as all of you know, this is an online program. This is not that you are going to get any print material. Yes, of course we will be trying to give you a program guide which will be printed, but the rest of the material will be online, which can be seen by you through your computers, or which you can download also. And this, as you know, the name indicates that this is a postgraduate diploma in acupuncture. So this is basically meant for the graduates, MBBS doctors, BMS, BHMS, those who have passed 5.5 year degree course, including 4.5 year course plus 1 year internship. Only those students are eligible. And as of now, we have got 35 students on the roll who have enrolled for this particular program. And as you know, the duration of this program is 1 year. The students who have already enrolled for this program, they must be knowing that the duration of this program is 1 year, and they can complete maximum up to 3 years. So if you have enrolled in year 2009, this batch will be known as 2009. If you see your enrollment number which I have sent to you, they all start from 09. When you write your enrollment number 09, it means that you are from 09 batch. So this will be 9. So you will be given 9, 10, 11. By December 11, we will not be charging any extra fees or any other thing for completing this program. But my request to all of you will be there, because since you have shown a lot of interest in this particular program and you are all Medicare graduate, what I will request to you, unless until there are some compulsions or something like that, try to finish this program in 1 year, because it is always better to complete the program within the minimum prescribed period, so that you don't carry away. But that margin of 2 years we have given if there is some emergency or some circumstances, prevailing circumstances at home, or some social obligations are there, or because of one or other reason you are not able to complete, then only you use that flexibility. Otherwise, my request to all of you will be that you try to complete this within a period of 1 year. Now, if you have seen your program guide, this is a 32 credit program, and when we say 32 credit program, it means in each credit, for each credit there is a 30 study hours in IGNOU system. It means you have to devote around 960 hours, maybe there are around 1000 hours you have to devote on this program if you have to clear this program. And if you see that there are 6 theory courses and 4 practical components are also there. So in all there are 10 programs. And let me tell you that I told you this is 1 year and 3 years, and we have got in IGNOU system, we have got 2 types of evaluation. One is continuous evaluation and second is the final evaluation. So in this particular program of 3 years, you will be supposed to come to the particular program study centers. I think the list of program study centers are already displayed in your program guide. So you will go to your nearest program study center, do the practical activities for 10 days. You have to go there for 4 times. It means in all the whole year of this 2009, you have to do 40 days of practical activities. These 40 days practical activities you have to record on a logbook, and there will be program in charge at the particular center which has been allotted to you, who will be signing all the activities. And at the end of each this contact program, you will be given marks. Some marks will be given to you based on your performance during that 10 days, and that is known as internal evaluation. And this internal evaluation carries a weightage of 30%. And the final examination which will be conducted towards the end of the program, that carries 70% weightage. There will be no theory examination during this 1 year in between. The theory examination will be towards the end of the program. That is, fixed dates are there. In the month of December this will be conducted, and as if you see your program guide, there will be 3 theory papers comprising of 70 marks each. So and for each thing, that theory paper, for practical internal assessment, for practical you have to get 50% pass mark. Like I was telling you, the theory paper, there will be 3 theory paper. Similarly, for each course you have to do 1 assignment. Like you are if you are going to a program study center for practical, there you will be also having some problems in the theory component of the program. So there what we'll be doing, that the academic counselor over there, they will be teaching you some theoretical portion also, and you will be given assignments. 1 assignment per course, it means 6 assignment you have to do, which will carry a weightage of 30%. Those 30% will go towards your internal assessment. So 30 plus 70 in the term and examination, so it will form the 100 marks of it. So there will be 3 theory paper of 300 marks, and there will be practical of 200 or 300 marks. That marks will let you know in the due course of time, and in all you have to get 50% marks. So I will not just if there are certain further details that we'll clarify as the session goes further. But now I will request Dr. Raman Kapoor to tell something about the history of acupuncture or something, because some basics of acupuncture or some guidelines to the instruction that how they should go about studying their material, and what are the things they can approach whenever, what are the areas when they need support, whom they can contact, all those things if you can tell the students.
Very good afternoon to all of you, and I must welcome you all to the launch in the induction today of the postgraduate diploma in acupuncture. First of all, I would like to congratulate all the doctors who have taken the initiative to join this course with IGNOU. Let me begin very humbly by telling that Dr. Arora has been very instrumental in the development of this course, and he has worked very hard with us to see to it that the quality of the course is at the highest standard. And the Vice Chancellor of the university, Professor Pillai, has been very, very supportive to me, and he has given me all the support to see to it that we are able to start this course. The idea to develop this course came to me at least about 7 to 8 years ago. I have been into practice of acupuncture for the last 27 years now in Delhi, and during my course of treating patients, I always realized the requirement for more qualified medical doctors to be available for treating patients. But I found that the number of such qualified doctors was quite less. There are factors which, as I tried to find out, because I had started teaching at Sir Gangaram Hospital, where I had the Department of Acupuncture in Delhi, and we were conducting courses for doctors there also, classroom courses. But I found that the medical practitioner is a busy person, and he or she is unable to get enough time to be able to attend a course which, if it has to be intensive, only then it will be useful to the doctor. Otherwise, his knowledge of acupuncture will be incomplete, and hence also his clinical results. So keeping that in mind, I gave this idea to my wife, Dr. Sunita Kapoor, and she is also actively involved with me in the practice of acupuncture. And we decided that we should develop an online course which would be a complete course as far as the theoretical component is concerned. We would also like to include all the important aspects of modern acupuncture which are being practiced in the Western world, as well as the traditional methods of diagnosis like the tongue diagnosis and the pulse diagnosis, which is used in China very traditionally till now and has been found to be a very effective tool for diagnosis. So looking at all these modalities, we thought that we must develop a very comprehensive course in acupuncture, and this course which we have developed is, I think, a painstaking effort of Dr. Sunita over the last about 4 years that we developed the entire course curriculum. And then our most important aspect was that we need to also teach these doctors the art of needling, because that is where the actual reason for the results lies. That means if you want efficacy and if you want good results with acupuncture, you should know the art of needling, and you should be able to practice that art of needling very well. So the idea of when I approached Professor Pillai with the idea of doing this course through the Indira Gandhi National Open University, my main aim was that it will have a bigger platform. And let me tell you, it is the first course of its type in India today which is recognized by a university and has been launched on acupuncture. Till now there is no such course available on acupuncture which is recognized by a university. So obviously it's a big leap forward, and I hope that all of you who have enrolled would be the ones who will take forward the lead from here and become quality practitioners of acupuncture and promote the science in a big way. And for that purpose only, the 4 modules which are the practical modules have been included, and each module is of a 10-day duration, and whichever center you choose, we have seen to it that all the 9 centers which are going to start are being run by practitioners or medical practitioners who got an experience of at least 10 to 15 years in the science of acupuncture practice.
So that is the qualification that whoever the program in charge will be there, that he must
have at least 10 to 15 years
of experience in that.
So the quality will be very high, and then we will be providing you with disposable acupuncture needles for you to learn the art of needling. And there is something which is known as moxibustion, which is again a therapy wherein a Chinese herb is burnt over the acupuncture needles, and this is also a very important component of acupuncture treatment. And we will also be providing you with these moxa rolls so as to make you learn the art of moxibustion. So basically what you require when you set up an acupuncture practice after you've done this course are needles, some moxibustion rolls, moxa rolls, and an electroacupuncture stimulator, which will be also shown to you during your entire course curriculum as you pass through the practical modules. I would now like
Thank you, Dr. Raman. Would you tell that which are the 9 centers? You mentioned that this program is going, they are going to have practicals at 9 centers.
Yeah.
Can you just tell?
Delhi is one of them, and then next is Punjab, Ludhiana we have. Then we have got in Rajasthan, in Kota. Then we've got in Kerala, in Thiruvananthapuram. Then in Chennai. Then we've got one center in Calcutta. Then we've got one center in Indore, in Madhya Pradesh. Then we've got another center at Hubli, Karnataka. And the 9th center is in Rourkela in Odisha.
So these are the 9 centers which Dr. Kapoor has told you, and you can choose any one of these which is nearest to your place. And if you don't want to choose nearest to your place, if you want to choose any other center, you choose that particular center, but let us know in advance so that the necessary preparation for your practical work can be made available there. Like he is saying that we have to provide you the disposable needles and all those things. So we worked out all logistics for your stay and everything at that particular center, and we are able to deliver the goods. So I will request all the students who are listening to us or who are watching us that please send your that option for the practical. It need not to be that where this thing. If you want, okay, there will be certain students who are staying at Surendram, but they want to do at Delhi. They can come 40 days here. We don't mind it there, because that is the beauty of this open system. Because we don't try to restrict you. It will be preferable that if you do from there, wherever you are there, because it will save your time and your money and your energy. But at the same time, if somehow or because of some reason you are not able to complete that program at that particular center, you can opt for another center also. That is, flexibility is given to you, but it's not mandatory. Now I'll come to Dr. Sunita Kapoor. Sunita Kapoor, can you tell our learners, those who have enrolled, that what are the courses, theory courses and practical courses they are going to, and any other word of caution that if they are going through this 1 year of course, what are the things that they should keep in mind and how they should plan their studies? All these things, if you can tell our learners.
Yeah. Welcome to all my students who are doing the PG Diploma in Acupuncture. We have 6 theory courses and 4 practical courses. Now, the planning of the practical courses has been done in such a way that once you complete your theory courses, you can ask all your queries regarding those courses in your respective practical sessions. The practical sessions are given a time of about 10 days, and they are spaced out after every 3 months. So approximately we have included the months of April, June, September and December for the practical contact sessions. Now, for the first practical contact session, you will need to do a theory portion of course 1 and 2. Course 1 will include the basic theories of acupuncture and how to diagnose a disease through acupuncture. That means the etiopathogenesis of acupuncture. Course 2 will include in detail the pulse diagnosis, the tongue diagnosis and all the other classical as well as modern methods of diagnosis and reaching to a conclusion for a patient. After this, we come on to the first contact session, practical contact session of 10 days. And then there will be you have to do third theory course, which will include the main meridians of acupuncture, which you must be aware of, or you can go, now you have the login and password of this course, so you can go through the meridian aspect. Before going in for the second practical contact session, you must do the acupuncture meridians, which is included in course 3. After the second practical contact session, you will need to do the theory component of course 4. And after the third practical contact session, you will need to do the theory component of course 5 and course 6, which will include the main diseases, all the diseases which can be treated with acupuncture, their syndrome differentiation, that how we diagnose that a particular patient is suffering from this disease and this syndrome according to the TCM theory, traditional Chinese medicine theory. and we do make a prescription for these patients for that particular treatment. And at the end of all the contact sessions, there will be a final exam, which will be a theory exam as well as a practical exam. And during these contact sessions, important thing is gaining lot of knowledge, practical knowledge of acupuncture. Important thing is that we at all the study centers, free camp of acupuncture will be organized, where you will be taught how to needle the patients, how to diagnose the patient, and the program in charge at the study center will guide you the needling on these patients, and with the same can be practiced at your workplace. You can always take the help of the program in charge. Even if the contact sessions have finished, you can always be in touch with the program in charge of that state for helping you in treating the patients in that in acupuncture mode. And you can take the help in diagnosis as well as treatment pattern. You can take the help in procuring all the equipments that is required in setting up the acupuncture clinic and in the treatment of these patients. Regarding the theory, if you have any problems, you can always contact us through our email. The email is given on the site. And secondly, we will be having lot of telecommunication and web conferencing, so that we can solve all your queries regarding the theory course. And even if you have still other queries left, you can always note them down and solve these theories during the contact sessions in the study center, whichever study center you choose. And so this is what I wanted to tell you about the theory and the practical contact sessions. Over to Dr. Arora.
So thank you, Dr. Sunita. I think with what I learned from your conversation, that the students need to learn the theories of the acupuncture. They need to learn TCM diagnosis. Then they need to learn about the meridians. Then they need to locate the acupuncture points, and then the treatment of that disease diagnosis, and then ear and scalp acupuncture and clinical acupuncture they have to do. All these things they have to do, which they may not be comfortable with this terminology, and even I am not finding myself comfortable. But I think we have got a journey of 1 year henceforth. Most of the things will try to make you understand. And as she has mentioned, that it's not only that you will be had access to the online material, but what you can do that during that 40 days, whenever you are there, it's not only practical. If you have got some difficulty in understanding some concepts, you can ask your programming charges. And even if you are not clarified, even in between you also want to ask, maybe you can send email to us. We will have a dedicated email ID for that thing. And what I will try to do, that we'll try to route it through the various experts who will reply to your queries. And as Dr. Sunita has told you, that we'll be having lot of web conferencing also. So during those web interactions, you can ask any question, if you want any demonstration, we'll try to do. And maybe time to time we'll be organizing this type of teleconferencing sessions also, in order to clear your doubts. Dr. Kapoor, would you like to tell some of the basic concepts in acupuncture, that because we have got another 10 minutes of that, just tell that student that how what is basic concepts and how they should try to, because what I feel personally, there may be certain students who must be having some idea of acupuncture. They must have read through some books, literature that which is available in the market, or they may have just browsed through the internet also. But when we are going for a professional course, so what are the things they should know beforehand?
See, again, as a medical doctor, when you go into any field, it's a specialized field. So acupuncture is a WHO recognized science today. It's a specialized field in itself. And any medical graduate, once he or she is enrolled with us, he will be obviously learning the entire system of therapy step by step. which would obviously include the basics as to what is acupuncture and how does acupuncture work. Now this is a very common question which comes to a medical doctor's mind. Now this has been answered very well by a lot of research which has been going on all over the world, particularly in US and UK, where they have shown that the pain relief which happens with acupuncture has been found to be caused due to the release of endorphins and enkephalins. And it has been well documented now that with each acupuncture session the level of endorphin and enkephalin in the blood goes up, and that is how the patient is able to get excellent pain relief. Similarly, there are the other effects of acupuncture. This is the analgesic effect, which is also very well utilized in doing small surgical procedures wherein the patient may be sensitive to a particular medication and he or she is unable to get that anesthetic medication. It is even being done today in tooth extraction, dental extraction for people who are allergic to xylocaine. So you can do a tooth extraction under acupuncture anesthesia. Then coming to the motor effect, acupuncture is known to increase the muscle strength. It also is known to have a muscle building effect. So these effects of acupuncture are utilized very well in treatment of diseases like hemiplegia, facial paralysis. Then another very important effect of acupuncture is the immune enhancing effect. There are specific points of acupuncture which, when needled, are known to improve your immune system or increase your immunity, and it stimulates the production of the immune cells in our body. So very effectively can be used in treating allergic conditions like allergic eczemas, allergic dermatitis, allergic rhinitis and sinusitis, and not to forget the chronic allergic bronchial asthma. These diseases are the grey areas which, when I passed out as a medical doctor, I realized we had no answer to in modern medicine. So we were always looking for answers, but we were not finding. So once you learn this art of acupuncture, I am quite sure you'll be able to help humanity in a big way, and a lot of your patients who would be coming again and again to you will be very happy and very glad to come to you, because they know that now not only do you offer Western medicine as a method of therapy, which is excellent for treating the acute problems, but for a lot of chronic problems, acupuncture is a method par excellence. And obviously it will be another method of treatment available to you for your patients. Similarly, you also get a lot of patients in your practice today who come to you for chronic headaches like migraines, and acupuncture is known to be very effective for treatment of migraines. I have had a chance of being into the practice of acupuncture for such a long time, and that probably is the reason that I have now started going into grayer areas of medicine, where probably when I started my practice of acupuncture I was not doing that much. But now I even treat conditions like optic nerve atrophy, retinal degeneration, retinitis pigmentosa, particularly in the early stages. So these are areas which we do not have an answer to in Western medicine, but acupuncture has shown a lot of good results. I wouldn't say that it is a curative therapy for conditions which I mentioned just now, but obviously it can help to a great extent in improving the vision of such patients and even in stabilizing the vision in such patients. So we have a very important role to play as practitioners in such conditions. Then coming to the other modern aspect of acupuncture, today cosmetic acupuncture is picking up very fast, and there are special type of cosmetic needles which are available, which when are put on the face can be used for facelifts, for removing crow's feet, for wrinkles, and particularly in an age group where we find that the reason is that the collagen tissue is reduced, and it is because of the lack of collagen that you are developing this problem, and the patient is early stages where instead of using any Western medication, you can use acupuncture, and it can be very effective as a tool. Similarly, you can also use needle-less acupuncture today for people who are coming to you, like small children will be coming to you. They come to our practice and they will be afraid of needles. So also we have got needle-less acupuncture. Now you would think, what is needle-less acupuncture? Needle-less acupuncture is a method wherein the point at which the therapy is to be given stays the same, which obviously you will learn as you go through this course. But instead of putting a needle you will put a laser beam or a color therapy, a color beam. So there are different colors which have got different properties as far as acupuncture theory goes, and so these can be utilized for using at same acupuncture points, particularly in small children who are apprehensive of needles, or even in adults who would be needle apprehensive, and the elderly patients.
They will be learning about all these beams and how to apply these things. Dr. Raman has very nicely mentioned that this acupuncture is an art. Should we consider it as a science, or is it an art of therapy?
It is definitely a science in itself. It's a complete science, like homeopathy, allopathy. If studied properly, you can treat any disease with
because it is based on all scientific principles.
Yes, all scientific principles.
Whatever you are telling, meridian and all those things, there are all scientific principles which has been tested over a period of time.
Yeah, what
not
art
over
means,
a period of time, but over years.
Over centuries. Art means art of needling is important in this. That is the main art in this. Yeah.
Okay. I think these are the things which Dr. Raman Kapoor and Dr. Sunita Kapoor had shared with you. But what I will suggest to all my learners, that to make this learning more active, because you see, you are all adult learners. You are not that +2 learners are there. But I will request you that if you can make your groups, student help groups, self-help groups, if they can make, because I have given the email IDs of all the students to all the students, so they can communicate among themselves also, and maybe whenever, as you were mentioning, that if we are having that web conferencing or something like that, at that point of time they can interact with us, and they will find so many other opportunities also. But what we have seen, that in our other distance learning program in IGNOU, what we have found, that whenever these students, if they form a group of 4 to 5 and they start interacting with each other, so most of the problems they are able to solve by themselves. Because if we keep on giving you everything ready-made, it may the learning becomes very passive. But if you just identify your problems, discuss with the other students, discuss with your teachers, and then you become an active learner, and then that learning is retained
more
for a longer time.
Becomes more interesting.
More interesting and more permanent also. And it's enriching also, because there are so many. If I am reading one book, other persons are reading other 4 references.
Knowledge is shared.
Knowledge is shared, and it is increased also in fact. So I will request that if you can form your own self-help group, and let me tell you, friends, that don't feel shy at any point of time. Whenever you feel like, even during the midnight, if you are going through your net and if you feel there is some problem, immediately email to us. But don't give a phone call at the midnight, but you can always send the email to us, and we will take care of all your queries, whatever the queries you have with regard to your that content part, your practical part, or any other administrative query. And with these words, I think I have to close it here, unless until if do you want to ask something? There we have got one student here. You want to ask something? Yes, please. You want to ask any question? तो आपको कुछ अपने सवालों के जवाब मिल गए, कुछ और पूछना चाहते हैं? तो आपको जो हमने बताया कुछ
सब आंसर्स आपको मिल गए हैं?
अगर नहीं होगा तो फिर आप हमारे को कांटेक्ट करते रहिएगा. So we have got one student. What is your name? Sanjay Kumar. By name of Dr. Sanjay Kumar, we have got Dr. Sanjay Kumar here with us, who has been throughout this teleconferencing and listening to us. So I think we'll find more and more viewers for this thing. You can always see that, you see this teleconferencing mode, you can have watch through DTH, Dish TV, then this Big TV and Doordarshan DTH system. You can see through that in your TV mode. Otherwise, what you can do, that you can go to nearest regional centers if you have got that one near. your residence, or you can go to some program study center of the IGNOU. There also you can see. Or if Delhi students, if they want, they can come to our studio and interact with our experts over here. We'll be very glad to help you across the face-to-face mode. So if you are present here, if there are certain queries, that our experts will answer to those queries. So you are most welcome to this place also. And this time we have to organize at this particular time, because this was the convenient time available for us for transmission. In future, whenever we are organizing teleconferencing, we will try to organize it on weekend, Saturday, Sunday, and we'll also send a mail to all the students to let us know that what is the convenient time. There will be 30 separate convenient times, but we are going to go by the majority, that which is the convenient time for our experts also, and this thing, students also. With the, so mutual consultation, we'll finalize the next teleconferencing timings also, and we'll from time to time we will be interacting through to you through this teleconferencing and the webcast. So with these words, I thank Dr. Raman Kapoor, Dr. Sunita Kapoor for being with us and giving very useful inputs to our students, and we hope in future also such fruitful interactions. Thank you.